there's some uneasiness in the community, in part because of, we've lived so long with this, and we've learned about what has been important, in particular to public health over the past few years. So things like contact tracing, accessibility of testing, the importance of declaring outbreaks. And now those things that we become used to are no longer available, and so people do sort of feel like, we don't have numbers anymore. I know obviously we can follow hospitalizations, but can you speak a little bit to that? How are you feeling as a proponent of public health now that some of these things that we feel have been keeping us safe, or have been allowing us to track and understand what's happening in our community, are no longer available?
Mm-hmm. It's a big shift, and I think it makes sense that people are struggling with kind of reconciling this new direction with the messages we have reiterated and emphasized over the last 2 years, and so it's going to take a bit of time. I think that what is different now is Omicron, and Omicron is a variant that is very different from the previous variants, and it has forced us to look at this differently. We can't look at it the same way because we don't have the capacity to respond the same way, so we have to look at it differently. And I think that that's certainly helped us in public health really understand why we need to shift. And looking at what the goal is. So for previous waves, we still talked a lot about containment, that we can really stop transmission. And Omicron is so infectious that that's not part of the discussion anymore, or it can't really be, because we can't contain it. What we can do is we can mitigate it. We can blunt its impact on our healthcare system. And that meaning that we won't have as many people admitted to hospital or ICU. Hopefully we won't have to cancel surgeries, elective surgeries, for a long period of time. And so when we move from containment to really mitigation, that's when we're looking at what measures we can do and can implement them. But I think it makes absolute sense that people are having a hard time shifting how we think about it. My hope is that this is kind of a next step before we get to hopefully an endemic state where, every time COVID-19 happens, we're not having to implement a huge number of restrictive measures to keep it under control. It will certainly continue to be here and will pop up here and there, but hopefully we'll be able to manage it in ways that are much less disruptive to education, the economy, all of these other things. So I think in that sense, I'm hopeful that this is moving us in a direction that in the long term is going to be much more sustainable to move forward.